Why is it behaving this way? Is your computer all fucked up?
Aloha, everyone.
Aloha. Welcome to Lāhui Updates. Today is Sunday, August 16th, 2020. And we are going to be talking about COVID-19 tonight and Kanaka Maoli. So we're very honored to have two guests, special guests, both of whom are Mauna medics. One of whom is the founder of the Mauna medics, and another doctor, a physician who has actually been a big part of the Mauna medics. So I'll just have everyone introduce themselves and just share a little bit about yourselves and who you are. And then we're gonna get started on the discussion. So we're gonna take an hour to discuss COVID-19 in Hawaii and Kanaka Maoli. Go ahead, Kalama.
Aloha aina, Kalamaokaʻāina kia palihuna ko'ola ka papa mokohina. Aloha, I'm Dr. Kalamaokaʻāina Niheu. I am the co-founder of the Standing Rock Medic Healers Council, as well as the Mauna Medic Healers Hui, and I am the Associate Medical Director of the COVID response in the East Bay in California for this time period, for this short period while I'm here in California.
And I'm Dr. Lorraine Sonoda-Fogel, graduate of John A. Burns School of Medicine and residency there as well. And I presently own Waimarriage and Care in Kamuela, Hawaii, on the Big Island. Aloha, everyone. So I'm the moderator. My name is Healani Sonoda-Pale, and I'm with KaLahuiHawaiʻi, a Native Initiative for Self-Determination. This is an important discussion we're going to be having tonight regarding COVID-19 and the pandemic that's going on right now. So I just wanted to kind of start with a little bit of background, a little bit of going over the statistics of the COVID-19 virus and what's happening now. So right now in the United States, we have a total of 5,500,000 cases so far. 3 million of them have recovered. We had 172,800 deaths. The United States makes up 25% of all COVID-19 cases worldwide, yet we only have 4% of the world's population living within the United States borders. So this is, again, very problematic because it shows that the United States does not have this virus under control, that there is things we need to start doing. And since Hawaii has been illegally annexed to the United States, it is part of our problem. We have a lot of Kanaka on Mokuhonu, and they're dealing with it. And Dr. Kalama Niheu is actually currently practicing on Mokuhonu, or the continent. So we need to be very cognizant of that, a lot of our people are on the continent. COVID-19 in Hawaii has actually risen in the number of cases recently. So we started with 2 cases on March 12, 2020. And by April 1st, we had 34 cases, the highest number of cases in that first wave, so-called first wave. I don't know if you would actually call that a wave, but in that first wave, we had 34 cases. That was the highest number it went up to. Then we went down to 0 in May for consecutive days in a row. And what I wanted to kind of point out before we kind of get into the discussion with Dr. Niheu and Dr. Sonoda-Fogel here, who's also my mother, by the way. What I wanted to kind of have a discussion on is when you look at the data, when you look at the statistics, what's happening. So there's a lot of factors to why these things are happening. And I've always kind of surmised or guessed that the rise in the number of cases actually correlates with the rise in the number of visitors. So when we look at the May numbers, so let me share that. When we look at the May numbers, we see that the numbers are less than 1,000. We have about 511 visitors or arrivals here in Hawaii. May 1st, it goes up to 844. One couple times it peaks to 1,000. So the numbers are relatively low in terms of the number of arrivals here in Hawaii. Oh, let me just, unshare that. So what happens is in the second wave of COVID-19, which started about the time of the 4th of July weekend, we have a lot, the numbers go way up. And now in August, we're into the triple digits. So if we look at the number of arrivals in, let's see, look at the number of arrivals in August or in July. Let's look at the number of arrivals in July. And this is when the second wave started. Okay, sorry, hold on 1 minute. Okay, so the second wave started in July, and the number of arrivals, if you look at these numbers, they go all the way up to almost 3,000 sometimes. They're way past 1,000, 2,000, 2,079 here. So the number of arrivals in July are way higher than the number of arrivals in May when we had the 0 consecutive cases in a row. So what is that showing us? Stop sharing. Okay, so what is that showing us? It's showing us that there is some kind of correlation between the number of cases that we have here in Hawaii of COVID-19 cases and the number of arrivals into Hawaii. So that is concerning. If we look at the August numbers, now in August, we started hitting the triple digits. We had the highest number of cases on August 13th. That was 354 cases of COVID-19. That was the highest number so far in one day. And when you look at the arrivals for August, and these are daily arrivals now, just keep that in mind. These are arrivals that are basically, that are not, it's not weekly arrivals, it's actually daily arrivals.
So almost 10,000 new arrivals a week.
Yeah. So when we look at that, let's see, let's get to that graph. So we look at the arrivals for August so far, we're up to 3,000. So August 3rd, 3,069. The numbers are way higher. So as we're going along, we should be checking these. And it's just I don't have actual proof, but you look at the numbers and the data, they correlate. With the rise in the number of arrivals comes the rise of the number of cases. So I think that is kind of key to understanding. I think it's important to understand these numbers because then it's important to look at how we're gonna actually approach stopping the COVID spread. So anyway, so I just wanted to share that, some statistics for you folks about what's going on, how many cases. And right now, today we had 220 cases. Yesterday we had 284 cases. As of now, we've exceeded 5,000 cases of COVID-19, 40 deaths statewide, most of them above 60. But there are some numbers below that. So we need to be aware of that as well. So I have some questions for Dr. Niheu and Dr. Sonoda-Fogel that I wanted to ask. As a layperson, I mean, hopefully you can kind of share without going too much into the science, so we can understand what you guys are saying. Okay, so in a nutshell, what is COVID-19?
Go ahead, Kalama.
So COVID-19 is basically coronavirus, which is one of the most common causes of the common cold that we have. It's been around for a really long time. Like all types of viruses, they have an ability to mutate and to turn into the different types of manifestations of itself. But the most current one, which is COVID-19 or 2019, coronavirus 2019, is actually a much more deadly version of what's called the common cold, which is one of the most common causes of the common cold. And I think a lot of you are familiar with it, that some of the presentations that you'll see will be fever, cough, shortness of breath, but also nausea, vomiting, diarrhea, certain rashes can occur, and loss of sense of smell or taste. Those are the primary ones that you identify with symptoms, but according to the data, it could be anywhere between 10 to 80% are asymptomatic. So what I tell people is that the number one symptom, the most common symptom of COVID-19 is actually no symptom at all.
Thank you.
Remember that other coronaviruses that we've seen since the 80s are the MERS and SARS, which everybody knows by their names in that way. They were early on, they were actually contained, unlike COVID-19, which has now become worldwide. So this is truly a pandemic. It's not unexpected. The last pandemic was a little over 100 years ago. It's not uncommon that we saw these things happen, you know, in our world. But this one was really not handled very well. And as a result, every country has had different responses as to how they handled it. And right now, America is the worst in all of the world in handling COVID.
So what you're saying is that COVID-19 is not a hoax. It's actually a real virus.
What do you think, Kalama?
No, I'm just saying.
Since we're in the trenches and the ones that are really in the ICU.
Not a hoax, people.
Yeah.
Well, I think that this is one of the things that I'd really like to share is that people that I know of have died already and are suffering in the ICU in Hawaii. And I think it is something that we all wish it was something that wasn't real, that it was a nightmare, that one day we're going to wake up. But that's not going to save us. It's not going to save our kupuna. It's not going to save our community. It's not going to save. And if you're really worried, the most worried about it, it's not going to save your businesses either. So the key thing about this is I understand why people would be in denial about this. I think that there's a lot of scary things that are happening right now. And there's a lot of reasons why people don't trust like mainstream media and science because I think as a whole, we should be more accountable to the people. But this is us right now, an example of more and more people coming forward and being accountable to let you know, you really have to take this seriously. If we don't take it seriously, our loved ones are going to be ill. And if we take it seriously, we have a best chance of taking care of ourselves and our Lāhui.
Yeah, and we always hear the word pandemic. So can you actually give us a definition for pandemic?
As I just said, it's when an epidemic, when you have a small little cluster, let's say Wuhan, and suddenly it loses control, you lose control. Then it becomes epidemic once it's within that country or in that area itself. And now it's become worldwide. And part of it is the world has gotten small as we evolve, in the sense that people are moving much more freely, you know, for whatever vacations, entertainment, for work, et cetera, et cetera. And as a result, the virus had, and you know, movies and books that we've seen that have come out, these were real scenarios that can possibly happen. And yes, it's happening right now.
So it's actually spread, a pandemic is when the epidemic spreads
Pandemically
to
around the world.
all the
Yes.
other countries. Okay, great. Okay, so next question, will it go away? Will this virus go away anytime soon? I mean, how long should we plan to have to deal with this?
I think basically like the influenza, I think coronavirus, COVID-19, this particular strain is now with us to stay. We had a possibility early on to contain it and possibly mitigate it and go the way of a pathway of smallpox. But unless we have an incredibly effective vaccine, and a lot of people don't really realize that most vaccines are not super effective. Most vaccines are partially effective, like for example, pneumonia helps protect against 70% of community-acquired pneumonias. It doesn't protect against 100%. And so here we have there is a possibility that the vaccine will come out and actually be very effective, but given the history of coronavirus, it's probably less likely, and it's already been mutating multiple different ways. You can see that the first Wuhan variation was what hit Seattle, right. But the variation that hit New York and has really gone really throughout the United States came from Europe probably, and so it had mutated in a form there. And then there's other mutations that have formed since then. And so I think right now it's at wild type. So I don't think that it's going to go away. We might have much more effective treatments and therapies and an awesome vaccine that comes out. Let's keep on hoping for that. But I think it'll probably end up being in the realm of like the influenza, where every year we're probably going to have a new vaccine for it.
Exactly. I agree with you. Just the nature of this virus. Remember, people, you have to understand what a virus is. A virus is an intracellular parasite. What do I mean by that? It has to infect you via, for this one, it's respiratory, yeah, aerosol droplets, and you breathe it in and it goes into your cells. It needs our bodies and our cells to survive. Once it goes into our cells, that's where they replicate and they take over. This one in particular, without getting too much of the science, is a bad player. It's an RNA virus, which makes it even harder in genetics to even start to begin to do a vaccine towards. And of course, it's a virus as well, so which makes it worse. So you have to understand that. So that's why wearing a mask and taking precautions, 6 feet, washing your hands, don't go out unless you have to. Decrease your contact as much as you can. So it is very real if you do that. It does decrease the chances of spread and you getting it. And
So what you're saying is there is no vaccine?
not right now.
Well, there are several vaccines that are currently in human trials. Russia rushed
I just said they had one.
to go out and just distribute. And one of the things I am very concerned about, and this is where I can understand where people are worried about conspiracy theories, because science has not always treated Indigenous people and Native people kindly or fairly or justly. There is a very real history of racism that has occurred globally, and it's still occurring right now, because we're detecting a lot of in the United States, but most of the 2/3 world don't have the testing capacity that we do, and we're even having terrible testing protocols even within one of the most well-off nations on the planet. And so I am going to be watching that very closely and carefully. And I think probably the two places that I'm really worried about is particularly Russia rushing to find the vaccine, and then also the United States, with Trump being so unpopular, also trying to rush it before the November election to try and salvage himself. He wants to have a magic bullet to win through all of this, when in the reality is it's science. You have to distribute it. You have to see what ends up happening. And I am concerned about it, but I am following it very closely. And people who are interested, this is an incredible momentous period of time when people are going to really see the veil has been drawn back behind what the scientific process is. It's been very obscured previously, but this is how science evolves. You have a theory, you have a hypothesis based upon real basic science, like for example, hydroxychloroquine did well in vitro, and then you find out it doesn't work out. Same thing with the vaccines. There's a lot of theories that are happening about what causes what particular protein that they're going to want to attach to, which one they're going to attack, and then how it actually goes about doing it. And there's more than 100 vaccines out there in potential development. Which one's actually going to be the most effective? And then when you throw in politics into it, and then also pharmaceutical businesses, and then this really warped, twisted medical industrial complex that we have, like, are people actually going to be distributing it? Is it going to be for profit, or is it going to be actually transparent and open and available to everybody? Not just, and I'm not just talking about the United States. We have to be appropriately responsible to places like Latin America, to Africa, to places in Asia where it's incredibly poor areas, that if we do not contain the virus there, it's going to just mutate and make its way back home. So we really need to address it on a global level and look at social equity and justice as a part of our own survival as a species.
Right. And I think you hit it on the nose a little bit when you said this will not go away. If you're afraid about your business, you better be recreating yourself at this point in time.
Yeah.
We have to take this opportunity to depend on a country that we've supported to support us. We've had no contact tracing. You look at countries like Korea, South Korea in exact, to see what they did initially, even keeping their economy open. But what they did was they tested everyone. Anyone that would walk up to their counter, they got tested. They were strict with masks because they had already gone through the MERS and SARS epidemic. HIV was an epidemic. It still is going on, HIV. So we have to look at these countries, and unfortunately, we didn't learn anything from them in the sense that we had a government that was so narcissistic that they boo-hooed scientists. Dr. Fauci, all of these people that have been significant worldwide have become suddenly disrespected. We are so fortunate to have these amazing people, and amazing schools, Harvard.
So basically,
John
we should be
Hopkins.
listening to the experts.
Yes, and in Korea, in particular in South Korea.
Listen to the experts.
No, in South Korea in particular, the only people that are actually allowed to speak on behalf of COVID are the doctors and scientists. If you look at their TV, not even their government is allowed in the room, and they speak on behalf of protecting the people. So got to give them kudos.
Yeah. So another question, I think people, and I'm just asking these questions that are circulating in the community that people are not sure about. So next question is, can you catch it? Can you catch COVID-19 after you recovered from it? So if you had COVID-19, you were tested positive, and you feel you've recovered, can you catch it again? Or are you immune all of a sudden?
Well, let's put it this way. Can you get the flu again every year? The answer is yes. Yes.
Okay.
And
it's mutating. Yeah. Oh, go ahead.
Sorry about that, Auntie. But I think that one of the things that there's some preliminary data that shows a significant antibody response lasting for about 2 to 3 months. And that there's very limited evidence of anybody really catching it for a second time during a short period of time that we've been collecting the data. There's been some cases, but they've been kind of questionable when they actually do a lot of research. Now, the thing is, there's a possibility that there's some promising preliminary data that shows that we may get some temporary immunity to it, and there might be some partial immunity, like for example, there's sometimes when the flu vaccine is only 50% effective, but you'll see that afterwards, that if you get the vaccine afterwards, you might get flu, but it might not be as severe some years. So every year it's a little bit different because of the mutation of the virus. So right now we have a completely naive population that doesn't have any immunity to it. And that's why it's so devastating right now. So there is a possibility that we will have an ability to, once you get infected, that there's a chance that you might not be able to get infected afterwards. But how long will that last? How extensive? Does it matter if you're asymptomatic? Does it matter what type of illnesses you have? Like, if you're based upon like being diabetic or asthmatic or have a comorbidity of being morbidly obese? All of these things that we know are really indicators of having a much more severe outcome. So the thing about it is the science is still unraveling. They're still unfolding. We're still studying it. We're so early in this pandemic, and that we're trying to find out the data. So if you go out and you assume that once you have it, that you are immune, you are gambling, that you are making a gamble, not just with your life, but the lives of everyone that you love. Because if you got the virus a while ago, and at one point does it mutate? How do you know if you've got a more virulent version of it? And then if everybody thinks that they're immune in your household, and you go out and you catch the new one that's now your family doesn't have immunity to, at what point are you going to be possibly bringing another infection? And your family might have dodged a bullet before, but who knows if you're going to dodge the next bullet, because we've all had coronavirus before, a version of it previously. If you've had a runny nose, if you had a hunabut a day, you've had coronavirus, but you haven't had COVID-19. And so this is something right now, those of us who are studying it, and that's basically what I do. I'm primarily responsible for the research that informs policy that affects where our institution takes care of 64,000 people, and I help determine that policy and that moves forward about how we manage and take care of that community.
Amazing. A Kanaka Maoli physician. Thank you.
Yeah, thank you. But it's like, I'm not going to gamble with your grandmother's life.
Not having that happen here. We have a Department of Health that is ill prepared and not taking any extensive measures, not taking responsibility. And of course, politics and financials play a big role in a state that the economy is solely based on tourism,
And military.
and military. And they are unaccountable as well.
Mm-hmm.
We do not know their numbers. We do not know if they get tested before they come to the islands.
Mm-hmm.
We don't know how many of them are coming. And then they're going into our schools as well and into our communities. So,
Mm-hmm.
yeah.
So, and just that kind of goes back to the statistics I was sharing and the correlation between the rise in the number of arrivals with the rise in the number of COVID. I wanted to share this.
But you also have to ask yourself,
but there's other factors
have
as
we
well.
been testing more?
Yes, we haven't.
Yeah,
so that's one of the problems.
There's actually a really, I'll go ahead and try and share it later on to the, share it to the feed afterwards. But I really recommend people follow the New York Times because they have made their coronavirus coverage and their graphics like, if you sign up for it, all you have to do is register. They have a wonderful graph that shows, is your state doing enough to do testing? And early on, Hawaii was like off the charts. We were testing like a lot, way more than apparently what was supposed to be needed. But then that dipped in July. And this is exactly when they shouldn't have dipped. It was a sense of confidence of like, the pandemic isn't over when you're over it. And I think the Hawaii government was over it, and they had to not be over it. And so in addition to testing, we needed to have excellent contact tracing. And that's another way that you can go about doing it. But we'll talk about that a little bit later. But if you can identify the tiers right now that the CDC put out, is that the tier 1 is that if you've for testing, if you've had all the symptoms, and 2, if you had a primary contact with somebody with a confirmed positive COVID-19. The second tier is actually people who are essential workers, healthcare industry. If you're working at a grocery store, if you're working at Kmart, if you are working in a nursing home, if you've been in contact, if in any of these environments, and you possibly have any one of the symptoms or not. If you've been out there, you have, particularly if you've had contact with other people that possibly might be positive, then you should be getting, that's a tier 2 investigation. And for people who have been going out and about and in a lot of contact with other people, especially when the numbers start getting higher, I do recommend you get tested about once a month. One of the things I did recommend also is after we had a lot of people doing from Memorial Day and July 4th, and then also with the protests around Black Lives Matter, to get tested within about 5 to 7 days after. But I got across the board from Hawaii that people wouldn't allow people to get tested except for places like Auntie's Hawaii Urgent Care. And so the idea that that there was a complacency that happened, and the thing about it is, if you're allowing people in from abroad, they are going to come into Hawaii and they're going to spread it. But the real concern is then if you're not able to detect the infection spread, it's going to hit the community. And that's what we're seeing right now. We're seeing community spread. So it's beyond the point where you could have been very, very clear about the contacts and tracing of people coming into Hawaii. And now it's gone to the secondary point where people got it from people who came in. And now people have been in, what is that? They had a potluck at with
Honolulu Hale potluck.
Yeah, they had a potluck. I'm seeing people getting sick at funerals, at weddings.
Right.
Right now, the current infection has been coming from these family potlucks, from these family gatherings, funerals, weddings, baby showers, baby luau's. People felt they were over the pandemic, and unfortunately now we're kind of reaping the fact that there is that responsibility that the state has to have, but we have to take.
You have some personal ones too. Very good. Yeah.
Mhm.
Yeah. How effective is wearing a mask?
Very effective. Yeah.
Should we be wearing a mask at all, like when we walk out the door, or how often should we be wearing our mask?
Whenever you're outside and potentially in contact with other people. Yeah, definitely.
Yeah, if you're even thinking about getting, like, if there's even a possibility that you're going to get within, I would say like about 10 feet of another person, when you're outside, I would say wear a mask. Right now, there's some initial data that's showing that that actually been able to pick up some viable virus from respiratory droplets and aerosols. And so that's why you see like the early diagrams where they showed people sitting in a restaurant, and they actually, people like 15 feet down the way, like 3 or 4 tables over, catching it because the way that the air conditioning recirculated. So more so if you're indoors, but if you're anywhere, you know, if you're even outdoors, when you're thinking you're possibly going to get within contact of 6 feet of somebody, then like wear a mask. If you're indoors, I say like 10 to 15 feet. There is several different layers of masks. And so really what we're trying to do is the initial data that they looked at, of course, we're looking at N95s with the face shield, and then looking at surgical masks. And people really refuse for a long time. And this is something that I struggle with people all the time, to not call, they don't call the personal masks that we have PPE because they haven't been able to really study them because there's so much variety. Now there's actually data that are coming out that it's actually very effective. If everybody wears a mask, I protect you, you protect me, but there's like down to like maybe 25, 30%, and sometimes up to 50% decrease exposure if you wear a mask, depending on what type of mask that you actually have. As far as the homing ones, if you have like multiple ply, if you have an N95 filter in there, if you have a better seal, it's not just an act of altruism, it's also an act of personal survival as well. So anytime you're indoors and you're going to be, and whenever you're indoors and there's a closed environment, that aerosol could be there. You don't know who sneezed in that area recently. And when you have those masks, it just shoots out of, you know, the parts wherever your glasses fog up, or you feel that air blowing on your hair. All of that stuff, if you are like talking or yelling, or you sneeze or you cough, it'll shoot out of the area and it could like aerosolize. And so you don't know if you have it. So if you have it and if you have your mask and you step into that and you lose you don't get 50% of the aerosolization, there's what's called an inoculation number. So like you have to get so much amount of the virus in order to actually get the illness. So if you can drop it by 50%, then you have a much better chance of getting it if you didn't have the 100% exposure. So masks are very effective. They're being studied like in a way that nobody's ever studied them before, and they're being shown to be super effective. But you can't.
I just read a paper by this PhD from Germany, Sao. He did a retrospective study of over 21 studies, mostly coming out of China. And the conclusion of all of it was, yes, it is effective. Period.
And there's no evidence that it's not effective. Right? Like, there's evidence that shows it. You should be wearing it.
In my office,
you should be wearing a mask.
I have basically opened up my office to recirculate air by having my air conditioner run, windows open, minimal contact only at the windows. And this is based on studies we did, infectious disease studies we did in TB. I just listened to a Harvard professor talk about, he was instrumental in that. And he, you know, I mean, most doctors are educating ourselves about what's happening, but does people really want to listen is the other key.
Yeah.
So despite us taking all these precautions, and you asked me for my recommendations for your own office, and you know, she initiated, and I'm sure your office, you are the key person, Dr. Kalama, in your office and facility. I'm sure everybody's on you for what do we need to do? How do we protect ourselves?
In Japan, they have a system where they actually have to get visited by a doctor or a physician or an expert. And if they want to reopen their restaurant or their business, they actually get professional advice. It's free.
Yeah.
On how to reopen your business. We don't even, I mean, we're not even there yet in Hawaii. We are not there. And I want to just say that our epidemiologist, our lead epidemiologist in Hawaii actually said in April that you don't need to wear a mask going out.
This is Dr. Park.
Dr. Park.
Well, you know, I think that the initial, and this is where that whole debate about what is PPE is important, because they couldn't say that, you know, because you didn't have the level of degree of protection that you got from an N95 with a goggle, that they were saying that, you know, we couldn't, you know, that that they couldn't say that you actually had any protection at all. But, you know,
But
early
now
on,
they're saying you do. They're
but yeah,
studying.
and the studies have come.
coming out. Yeah.
So, I mean, it's like, I think that, you know, I do forgive them a little bit about the epidemiologists because, you
Good.
know,
Thanks for explaining that, because I was appalled when I read that.
yeah, and that's the thing, is that's really important to understand, that some of it was like, the mask will not protect you in the sense of, it won't protect you in the way that we say we guarantee our staff members when they go into a room of a COVID-19 person. We cannot say you are protected. And so that level and degree of standard that you would talk about in like a hospital-like situation where 99% protection, still 50% is still really high. I mean, like if I was gonna have somebody shoot a gun at me and I got
Some protection at least, yeah.
if somebody would tell me I got a 99% chance of catching this bullet versus 50%, I'm going to take every percentage I can get. And that's where you add on the percentages, the mask, the distance, washing your hands. It's all additive. You know, it's like you don't, you know, if you get really close and you have a really great mask on and it's not properly fitted and you got that 1% and it got a little bit loose and you got all this shield and everything, you know, if you stick your face right on somebody, they sneeze right in your face, it's like you can catch it. You know, I mean, it's not 100%, or if there's a break in the seal. So, you know, nothing's 100%, but you know, think about everything, you know, run the numbers, add them up.
Also a level of common sense. We as physicians have always been in contact, even in training, with infectious disease. This is an infectious disease. This is a very spreadable disease. This is a very toxic disease. And it is now here to stay. We will have to ride the course. How long?
Yeah.
Very long.
I want to show you guys these statistics, and you know, we can just talk about them a little bit. But when you look at this chart, which shows the number of Hawaiians or Kanaka Maoli who have contracted COVID-19, we're at 14%, and we make up about 21% of Hawaii's population. And then you look at the Pacific Island population, they make up 27% of the COVID-19 cases in Hawaii, but they are only 4% of the population. That to me is very concerning. It's, you know, with our Pacific Island cousins and with the Kanaka Maoli numbers, we're not the highest. When you look at these numbers, we're pretty up there, you know, 14%. We have the Filipino population at 18%, the Caucasian population at 20%, and you know, you look at the Japanese, the Chinese by race, they're way lower than we are right now. With Hawaiians, with Kanaka Maoli, that's pretty high, I think. Even though we've had, you know, I feel that we've had really good role models in the community with wearing masks. I mean, you know, our people have been, I mean, from what I've seen on social media, our people have been going out there and actually giving out masks for free, you know?
Well, when you look at these numbers, you have to look at what's behind these numbers.
Yeah.
These numbers are, there's a lot of factors altering or affecting these numbers. And the groups of people that you mentioned are the people that are mostly in service-related jobs, number one. If you, like, for instance, you have one person in your family, it's a service-related job, and comes home, high risk, they come home, guess what? Yeah. So also, if then they have parents or family members, because that's a lot of these people, including Filipinos, we live in a very extended home. Most of us, look at us. We live in an extended home.
We have 3 generations
we have
in our
3
house.
generations in this home. And that's very typical of most Pacific Islanders.
Right.
So you've got a lot of other factors affecting these numbers. That's why we have to be a lot more astute in how we even treat our kapuna. When I was in quarantine in Kauai, no one was allowed even on the property, you know. And the beautiful thing, and I have to shoot out some kudos to Kawakami, because he was a hero in leading really good, he's the one that put quarantine to what it should have been, including, hours that you should be on the road. After 9 o'clock, no one should be on the road till 5 a.m. Simple as that.
So I think that's really key, because a lot of us as Pacific Islanders, because in our household, we're actually Kanaka Maoli and Samoan. So we have, and that's why it really affects us. And a lot of our people are mixed. We're Pacific Islander and Kanaka Maoli. We don't discriminate.
Yeah.
But what I wanted to kind of make the point about is that as families who live in multi-generational homes, when we go out there, we have to be careful, even more careful, because we're coming home. So in our family, we have my mother, who's a kupuna, and my uncle, who's also who's a kupuna as well. So we're coming home, we have to be really careful, not just of what we're bringing home and to our children, but to our kupuna as well. And I think that for Pacific Island families and for Kanaka Maoli families, that's something we have to be a little bit more cognizant of, and understand that that's that other layer of protecting our family, right now. Yeah, go ahead.
One of the things that's really very, this is that this in a type of pandemic, what it'll do is it'll reveal the fissures and cracks of injustice and racism and classism within your society. And we have, when you look at the incredibly disproportionate effect upon Pacific Islanders who are non-Kanaka Maoli, it's because a lot of folks who are coming in as basically economic refugees from their own homelands are living in much more crowded conditions. That there is, like you said, they're in service industry. They're in industries that don't have sick time. They don't have guaranteed health care. They don't have necessarily they don't have the ability to take off time to quarantine themselves. They don't have anything like a separate sink or bathroom that they can go into, and they all have a shared a cooking area, or we have one. But the ones that are really affected are the folks that I see that are living in 14 or 15 people within a 1 to 2 bathroom home, and it's really I think I've been a little bit ashamed as well about I think our people in Hawaii are so loving and so welcoming in so many different ways, but I am a little bit ashamed about what our responses have been as far as judging our cousins, our other Pacific Islanders, in regards to the ones who are stricken by poverty. And it's really affecting poverty that's causing it, an unequal racist system that has also affected our communities, our families. And part of what we're seeing here is the fact that we have to look at the weak, because just like the 2/3 world, if we have people in Hawaii that are affected, it's really not only a matter of time before it's going to affect the rest of us. Healthcare should be a universal right, and we shouldn't be judging other people based upon what's happening in a pandemic, because they have no choice but to expose themselves in order to maintain a house or food in their mouth or take care of their family. So I think it's really important that we reach out and that we talk to each other and educate ourselves and really combat the internal and internalized racism that a lot of people have against our own cousins and relatives from the Pacific Islands.
I agree. And you and I have worked in Hawaiian healthcare systems. Kalama and I, by the way, created the first primary care clinics for the Hawaiian healthcare systems initially. And that was in the, early 2000s.
Right.
Yeah. And we also worked in community health centers, which she is still working in a community health center. So we have basically worked tirelessly in these communities of need.
And Kalama, you've worked with
Standing Rock,
with the Micronesian population,
yes.
a large
So,
number.
there was previously right before I came to Hawaii to do work over here, and then I ended up getting caught up in Mauna Kea, so I extended my time. And now the pandemic, where I'm not going to move during this process right now and expose myself and my family members more. But I did previously work at Kalihi Health Center, which is we have large Micronesian population. And I also worked, was trained in Kwajalein and Majuro and Ibai as well, taking care of our, Micronesian cousins over there. And, all I can say is that the grace and of Papa and the beauty that he has to our Hawaiian people and our entire Pacific Islander family. I am so grateful and so honored to have served in this community because we are one Wananui. We are one family.
Yeah. And Mom, you work in sorry, Dr. Fogel. You work in a Hawaiian community as well currently. So
Kamala has
you
one of
serve,
the largest populations of homesteader Hawaiians in the state of Hawaii.
So I think it's important, to have Polynesian physicians giving out the right messages to our people and to the community that this is not something we want to play around with, that we have to take it seriously. We need to take all precautions. We need to take some personal responsibility and also do everything we can to protect our families and our kupuna. So I wanted to share this graph and go on to contact tracing. This is actually from Washington State. And I thought it was like one of the simplest graphs on contact tracing. Because recently that came up in Hawaii as one of the things that it looks like we don't have enough resources to do this contact tracing efficiently and this is a really important piece in stopping COVID,
I think we need to restate that not having resources. When I looked up how much monies the state of Hawaii got via grants, including a grant for contact tracing, it is in the tens of millions of dollars. In fact, over 100 millions of dollars. So therefore, where has all of this gone? And why is it not intact in our state? Yeah.
So, thank you, Mom. So when you look at the contact tracing, it's pretty simple. It starts with, quarantine upon first symptoms, test widely, then you isolate, and then you identify the contacts, and then you quarantine the contacts. And what was brought up at a press conference this week with Congresswoman Gabbard was that we are not testing widely. That's one of the pieces in the contact tracing we're not doing properly, because we're not testing asymptomatic people who have had contact with people who are tested positive. So, and that could cause some kind of breakdown. We also found out this week that we don't have adequate number of contact tracers. And what concerned me, and this is just my perspective from my point of view, what concerned me when I saw the surprise visit by the legislators into the Department of Health, I noticed the contact tracers were actually all Caucasian. So I'm wondering, is that affecting the number of Pacific Islanders with the spread?
Yes.
And because
Absolutely.
I've dealt with the Micronesian community. It's they're
and the Hawaiian community.
And the Hawaiian community.
We're not going to
the Samoan community.
If there
and the Filipino community.
Right.
It can go on and on. Yeah.
And there's a level of distrust because of a lot of
Exactly.
institutional abuses that have occurred. Just the abuse of monies in regards to sort of violence over on Mauna Kea. Why should people trust the state of Hawaii? And so anybody who is coming in to do contact tracing, what they're doing is they're going to ask you, who have you been around? What have you been doing? What have you, did you go to a party? Did you go to a gathering? Who was at that gathering? These are incredibly personal, intimate questions to be asked, to be asking somebody, and people have to trust the people who are asking them. And you have to have the time to build the rapport. You have to have the energy, and you have to have the love of the people to really just put it in there and to continue, and without judgment and with good understanding of what their circumstances are, and understand for reasons that people are worried about telling personal information to a faceless, void, and so
especially if you can't make that connection, the cultural connection. So, I mean,
It's
not all of our, and I'm not saying that, but some people are not doing all legal activities 24 hours a day. There has to be some type of trust and some kind of, attempt to be made, and one of the recommendations that was, that's posted, that there was a letter recently by a task team for COVID-19 dealing, there's a task team dealing with Hawaiians and Kanaka Maoli here in Hawaii. And one of their recommendations was to basically hire Pacific Islanders to do contact tracing. And the interesting thing is that there's contact tracing seminars or certified programs you can actually take online. It's free. You can, there's tons of them right now.
But you also have to be culturally sensitive when you do this testing, even with particular groups. And so we in University of Hawaii, John A. Burns, had to take cultural classes, even though we grew up here, to be more sensitive to the clients that we would be taking care of.
And right. one of the things that so at places where we have community health workers for community health centers, we employ people who are working in and living in the community. When you're poverty stricken, for those of you who have experienced this, and I've experienced this myself, sometimes you're not able to afford your phone bill every month, and then you lose that phone number, and you can only get the temporary phone number. So your phone number, if you're very poverty stricken, can change, every month to every other month, and you might lose contact. So what happened with some of our CHWs were, they would know the community, they'd know the churches that people would go to, that they would know the community members, they would know their sister or their cousin, they would know people in an independent way, and they could trace through the kin networks and actually track down people. And there was that trust and that level of trust that was there. And it didn't go into any electronic medical record, and it wasn't on anybody's paper. They found out these kin networks because people trusted them. And so these are the things that for myself, I am pushing, particularly for Pacific Islanders, but also for Latinx, Black African-American folks. We have people over here who are from, the South and Central America who are undocumented, and there's terrible racism and ICE attacks that are happening on a regular basis. So here we have, the trust is so incredibly important to be based in the community. So you really have to, I've really been pushing the Department of Public Health everywhere to collaborate and actually give monies directly to the community health centers who have relationships or already have CHWs in the community, that we've been reaching out about pap smears and fecal occult blood tests and mammograms and doing the kids' vaccines. And they have this experience with reaching out to people because they have, a lot of them already have a trust and a network and a process that's very informal within a formalized structure. So, I think that this is, I'm very grateful for actually, the more than 100 people who have been trained. But what they need to do is they need to provide resources to these community health centers who take care of the most vulnerable, who are the most likely to have this illness and the most likely to catch it and the most likely to transmit it, not just to their own families, but to you as well. When you go to get your poke bowl, or you go over and you get your, go shopping at, Safeway, or you go to, all these places that you're out and about, you need them to be healthy in order for your family to be healthy.
Right. Thank you.
And that's true. These people that are in the service department jobs, we have to show some respect to them as well. These people going up and saying, I'm American and I don't have to wear a mask. Basically, you're just so disrespectful to these people who are actually putting their lives on the line because they need the income, and number one. And, they also need the health insurance. The other thing with contact tracing is testing. And testing is a problem because it's a nasopharyngeal swab. Even meaning we go through your nose and we go all the way in the back of your nose. But also you can take a oral pharyngeal swab as well. But that is at risk for the person who is actually swabbing you. And that's why the labs don't even want to do it. So they leave it up to the offices to do it. So our staff, my staff has been trained after I looked up data and how to do it correctly. But the thing is, there is no sites where people can just go and get a good swab and get a good test. And that's also, and the key thing too, just recently on the requisitions here in Hawaii, they just started putting your uninsured information, because the government under the CARES Act had put out monies to every state in the nation for uninsured. You can go to a community health center. If you're uninsured, they are entitled to a certain amount of monies from the federal government just to see the uninsured. So there's no excuse, even when you're uninsured now, to not come and go and get a test.
Yeah, there's so many factors. I mean, where is the money going? And you know, the Department of Health had $50 million. How come they only got 15 contact tracers for the entire state of Hawaii?
Yeah. So how much is each of them making per year?
I wanted to share this this letter. It was actually a really important letter. It came out in the Civil Beat. It's from the Native Hawaiian and Pacific Islander Hawaii COVID Response Recovery Resilience Team. It's a very good letter. They are a team that came out of, I found this on Papa'ololokahi. So it's Sherry Daniels, Joycelyn Howard, Keaweai Moku Kaholokula, Fele Lai Ta'u.
Are they physicians, nurses, nurse practitioners? Are they
So,
healthcare workers? We need to know. We need to know who these people are and where did they get these funds from and what are they doing? They're just putting out a paper.
Well, so they're actually giving. They actually wrote a letter of suggestions to improve the contact tracing and education and quarantining and outreach to the community.
So Sherry Daniels is the head of Papa'ololokahi. I can't remember what her degree is. Keaweai Moku Kaholokula is the head of the Native Hawaiian Center for Excellence at the University of Hawaii at Manoa. I think Feleai Tau, I can't remember where, or Josie Howard are from. Kim Burney, whose name is on the press release.
Yeah, I saw that.
Time in Kanaka Maoli communities, particularly with Papa'ololokahi and Ahui Onakauka. And so, you know, I've actually, after, thanks for sharing this, I actually reached out to Kim and I'll be joining in this with this group as well. And I think Dr. Sonoda-Fogel will be a great addition in addition to that, because I think that we do need to have more physicians and more people who are working with the community, because they have like several, you know, doing things like communication, policy, research, testing, contact tracing. So they're going, you know, they're looking at a variety of different things. And so right now the funding part, I know that through Papa'ololokahi and is through the Native Hawaiian Healthcare Act, and the University of Hawaii is they have their own funding through the University of Hawaii. The other folks, I'm not quite exactly sure about where they're from, but the Civil Beat article, I can talk a little bit about them.
This is when we should be using our community health centers,
Yeah,
because they have some of the highest risk groups.
because they're already set up in the communities.
But you don't have any kind of real good leadership in doing any of this in the state right now. So our numbers are going to just continue to increase significantly. That's all I can say.
And I feel education has been kind of, I mean, they're starting up a campaign now to educate people to wear masks, but it's, I mean, we're like, what, 4 months into the pandemic, you know?
We're so far in already. And so, you know, I that's why just for everybody to know, I am actually going to, I've made a commitment to every week doing a little bit of a live stream for my personal page, and you can look at Kalamaokaʻāina, or you can go to Mountain Healers Week, and I'll post it once a week, and I'll talk about different parts, and I'll go into science, and I'll go into some of the discussions about it, because I know there's a lot of people who have a lot of questions about it, and I go into like a little bit more nitty gritty, and it's going to be a weekly thing. So this is this week's installation of it. Next week, I'm going to actually go into the science of masks. And so just for people there, and every week
I should forward you that letter that paper I just read, and I put it out for my staff. It's actually with one of the science magazines that I saw and I picked up, because he did do an amazing retrospective study. His name is Sao, Tsao, and he's out of Germany. He's doing his PhD there. So, but I'll forward it to you.
Thank you. I'd love to see that.
It's an excellent paper.
So
Yeah.
I want to, yeah, and thank you. So that's a great resource. So Kalamaokaʻāina's Facebook page, you'll be
Right on.
posting weekly on just giving us some tips and some good information coming straight from a Kanaka Maoli physician. And this is reliable information. And we need to go to the experts to get the information regarding COVID-19. And I also wanted to share.
The CDC site is
Yeah.
also an excellent site.
Yeah, share that here.
Simple. They put out some simple diagrams of just the simple act of what to do. And they're actually well organized. It's simple. It's not very difficult. I use it on my website a lot. The CDC site.
It's a really good site.
Yeah.
Also a good resource is go to Lieutenant Governor's page, Josh Green. He does a really good recap of like the number of ICU beds we have left and the number of COVID-19 cases.
I think it's important that he does that because it gives us a picture of the severity of our disease that we have here in the island. Once we start using up our ICU beds, and you know, the major center is Queens, but we're going to start using Straub's. Kaiser had to close and send their patients over to Polimomi as well as to Queens. So once we start seeing these beds being taken up with this illness, we know how severe it is. Yeah.
And that's basically what you're seeing in places like Spain and Italy and New York during the beginning of the pandemic.
Exactly.
It's not just a matter of like, you know, how deadly the infection is, because, you know, we're having, you know, in places like where they did a lot of really good testing, like for example, in South Korea, the mortality rate is somewhere between 1 to 2%. But when you throw on top of that, you know, not having like, there's supposed to be 1 to 2 nurses per ICU patient. And you do like 10 ICU patients for 1 nurse. Of course, the mortality rates are going to go up. If you don't have enough PPE, if you run out of ventilators, if you run out of, you know, if first responders are going, you know, getting ill and sick and they're not able to pick you up, if there's a 20-minute queue before you even get into the emergency room, if you have on top of that, they studied in New Jersey, New York, and like the 4 states that were primarily affected. The initial spike in the United States, it was, you know, there were thousands of people who died on top of what was suspected for COVID. Because what do you do when you are having a heart attack in the middle of all of these things that's happening? The last place a lot of our people are wanting to go to is emergency rooms. Yeah. So if we have a situation where, you know, we all know like how many people that we know, family members who have gone to emergency rooms in our lifetime. If you think you're going to possibly have to go there when you're going to be surrounded by people with COVID-19 and you're having a stroke, we know that a lot of our people are not going to go to these places. And I'm really grateful that they put into effect a lot of more of infection control, and there's a lot more understanding about how to take care of these things. But still, you know, you don't have to have you know, a 50% mortality rate in order to overwhelm the system. You know, the biggest problem with COVID-19 is that you have, well, there's several problems of it, is that like nobody's immune. You have about half of the patients don't have have symptoms. And then on top of that, a lot of those who have symptoms don't develop it until they're at the peak right after or at the peak of their infectivity. So they travel around, they spread it around to everybody. And then on top of that, you know, if you get really sick, it's not like you're just sick for a little while. You're sick for like 3, 4, 5, 6 weeks before you actually pass. So this is a very prolonged illness. If you're critically ill, you can just go from a sniffle to no symptoms for some people. And that's why the young people are the ones who are spreading it around right now, because they don't have a lot of symptoms. But the people who go to being, you know, dying right away from heart attack or stroke because there's clotting problems with it, to being on a vent for 6 weeks and then finally passing. So, you know, if you have that, it's the length and the number of people that we see that can potentially overwhelm. And that's why you'd see a very high mortality rate in places like New York and Italy and Spain at the peak when they just ran out of resources. So Hawaii, you don't want to get to that place. This is something Hawaii has a very limited resources. If you overwhelm the ICUs, there is like, where are you gonna go? You know, they just can't go anyplace else. You're gonna get people shipping ventilators from California or New York. You know how long that, we all know how long that's gonna take. And you know, there's the priority that the state has been showing about the, you know, the resources that they're providing, really prioritizing military and tourism. You know, there is a protection that you guys can have, that we have the power as a people to protect ourselves, protect our loved ones. So let's, you know, we know that we can't rely upon them to take care of us. We're going to demand accountability and ask and say, you have to start taking care of us because we are the people of Hawaii. But at the same time, we do know that when it comes down to it, when it comes to really saving our own lives, that we need to be ahead of the curve, because people aren't going to come for us. They aren't going to come for us. So we have to come for each other. We have to show up for each other.
We're not going to have a floating ship with a big cross on coming to our shores.
Maybe for the tourists, maybe for the military.
Yeah.
But I don't think they're really going to.
And by the way, so I went to the RIMPAC protest today, where we had a caravan going towards Pearl Harbor, but RIMPAC starts tomorrow. That's 5,000 people on 10 ships from across the world. And if they get sick and they have to use our hospitals or they have to come on shore, they will overwhelm our.
And this is basically, you know, if you look historically at what happened when Dr. Sonoda-Fogel was pointing out, was in 1918, last pandemic was a Spanish flu. And part of the reason why they called it the Spanish flu is because it was the middle of the war that this ended up spreading. So you had people who came from all over the world, such as like coming to RIMPAC in close quarters, like a cruise ship, you know, that is basically, it's a militarized cruise ship, coming into these close quarters from all over the place. And we all know that these very close quarters are, you know, just petri dishes for infection. And that's why the Spanish flu became such a horrible, disseminated global pandemic, is because of military exercises and war and people, you know, spreading them globally. And so things like RIMPAC are definitely going to be, you know, they're a huge risk, and one that our people shouldn't have to be bearing the burden of.
Okay.
We have mass graves from the Spanish flu on the islands.
Oh, really?
One of the largest ones was Kauai.
Wow, I didn't know that.
So if you now remember New York having a mass grave, and we're looking at all the Middle Eastern countries opening and having mass burials. I mean, it is going to be very real for everywhere. Nothing is sacred now.
Yeah. I want to share one more.
Let's make it sacred.
Yeah.
Yeah.
Want to keep track of the numbers. This is a great website, worldometers.info. You can look up Hawaii. They have charts. They even look at active cases. So you can really look at the numbers, and it'll break it down. You can go state by state. You can go and look at any country you want to look up. That's another good resource. So we kind of ran out of time, but I wanted to just end with some manaʻo, or just some words of wisdom from our physicians. You want to go first, Mom?
No, I just want everybody to be safe and be serious about this. I worry for the world, and I worry for Hawaii and the people we take care of every day. So
thank you. And Kalama?
I think that we have to remember that the first color print newspaper was by, you know, in the world was Hawaii. We were the first constitution in the world that enshrined, you know, non-discrimination based upon race in the world. We were our Healani Palace had electricity before the White House. We, our people, are innovators. We are the front edge of science. We are globe travelers. We are sustainers. We are aloha. So this, to me, is the time when we can show the world what we're made of, right, and we can be at the forefront of taking care of ourselves, our families, and our Lāhui with the best-based Kanaka observation and science, and that we can share that as a gift to our families and to the world. This is the time where our people can rise. Right.
Mahalo, Dr. Kalamaokaʻāina Niheu, Dr. Sonoda-Fogel, for coming onto Lāhui Updates.
Mahalo,
And I
Dr.
want to
Kalama.
just say, have aloha and wear a mask. That's all I want to end with. And thank you so much for joining us for this important discussion. Aloha.
Mahalo.
These are my heroes.
Love you.